In this video, we'll explore the 10 alarming signs that indicate your blood sugar might be too high. But before we jump into that, let's understand what causes blood sugar levels to spike. High blood sugar, also known as hyperglycemia, occurs when there's too much glucose, sugar, circulating in your bloodstream. It's primarily caused by two factors: insulin resistance and insufficient insulin production. Insulin resistance happens when your body becomes less responsive to the effects of insulin, a hormone produced by the pancreas. This reduced sensitivity makes it challenging for glucose to enter your cells, leading to an accumulation in your bloodstream. Several factors can contribute to insulin resistance, including excess body weight, a sedentary lifestyle, poor diet choices, and genetic predisposition. If left unaddressed, insulin resistance can progress to prediabetes or even type 2 diabetes. Insufficient insulin production occurs when your pancreas doesn't produce enough insulin or produces it ineffectively. In type 1 diabetes, the immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. In type 2 diabetes, the pancreas may still produce insulin, but it's either insufficient or doesn't work properly. Various factors contribute to insufficient insulin production, including genetic predisposition, certain medical conditions, obesity, poor diet, and physical inactivity. Lifestyle choices and underlying health conditions play a crucial role in the development of high blood sugar. Now that we understand the causes, let's explore the 10 alarming signs that your blood sugar might be too high. Remember, if you experience any of these symptoms, it's essential to consult a healthcare professional for proper diagnosis and guidance. Just a quick reminder, this video is for educational purposes only, so speak to your doctor if you have any medical concerns. 1. Frequent urination. When blood sugar levels rise above normal, a condition known as hyperglycemia, it indicates an excess amount of glucose in the bloodstream. Normally, the hormone insulin helps regulate blood sugar levels by allowing glucose to enter cells where it can be used as a source of energy. However, in individuals with diabetes or those with poorly controlled blood sugar, the insulin response is inadequate or absent. As a result, the body's cells may not receive enough glucose for energy, while the glucose continues to accumulate in the bloodstream. To prevent blood sugar from reaching dangerously high levels, the kidneys step in to filter and remove the excess glucose from the body through urine. The excess glucose in the urine acts as an osmotic diuretic, which means it draws water from the body into the urine. This process is known as osmotic diuresis. As a result, the volume of urine produced increases, leading to more frequent urination. This symptom is often referred to as polyuria. Polyuria is a significant sign of high blood sugar levels because it is usually more noticeable than the typical urine output. It can disrupt daily routines, affect sleep patterns, and result in a frequent need to use the restroom. Additionally, the increased urine output can lead to dehydration if fluid intake is not adequately replenished. Dehydration, in turn, can further contribute to symptoms like excessive thirst, dry mouth, and fatigue. Frequent urination is not exclusive to diabetes or high blood sugar levels, as it can also be a symptom of other conditions such as urinary tract infections or kidney issues. Therefore, it is important to consider other accompanying symptoms and consult with a healthcare professional for proper evaluation, diagnosis, and appropriate management if you are experiencing frequent urination along with other signs of high blood sugar, or if you are concerned about your health. 2. Excessive thirst. When blood sugar levels are high, the body tries to remove the excess glucose through increased urine production, as mentioned earlier. This process, known as polyuria, leads to a larger volume of urine being produced and more frequent trips to the restroom. As a consequence of the increased urine output, the body loses a significant amount of water. This loss of fluids from the body can lead to a state of dehydration. Dehydration occurs when the body does not have enough water to function properly. Dehydration triggers various physiological mechanisms in the body to maintain fluid balance. One of these mechanisms is the activation of the thirst response. The body senses the depletion of water and sends signals to the brain to increase fluid intake, resulting in an increased sensation of thirst. Excessive thirst, medically known as polydipsia, is the body's way of attempting to replenish the lost fluids and restore its water balance. The sensation of thirst prompts individuals to drink more fluids in order to meet their body's demand for hydration. It's important to note that excessive thirst can be a symptom of various conditions other than high blood sugar levels, such as excessive sweating, certain medications, or other medical conditions. However, in the context of high blood sugar levels and frequent urination due to diabetes, excessive thirst can be an alarming sign of uncontrolled blood sugar and potential dehydration. If you experience persistent excessive thirst, it is advisable to consult with a healthcare professional for evaluation, diagnosis, and appropriate management, especially if it is accompanied by other signs of high blood sugar or if you are concerned about your health. 3. Persistent hunger. When blood sugar levels are elevated, it indicates an excess amount of glucose circulating in the bloodstream. Normally, the hormone insulin helps transport glucose from the bloodstream into the cells, where it is used as a source of energy. However, in individuals with diabetes or those with poorly controlled blood sugar, the insulin response may be inadequate or absent. When insulin is insufficient or not functioning properly, the body cells may struggle to effectively utilize glucose for energy. As a result, even though there may be ample glucose in the bloodstream, the cells are unable to access it efficiently. This condition is known as insulin resistance. Due to this ineffective glucose utilization, the body cells may perceive a lack of energy despite the presence of excess glucose. The cells send signals to the brain, triggering hunger sensations and leaving the person feeling hungry even after eating. Persistent hunger, or polyphagia, is the body's response to the perceived lack of energy at the cellular level. It is an alarming sign that the body's cells are not getting enough glucose for their energy needs, even when there is an abundance of glucose available in the bloodstream. The feeling of persistent hunger can be distressing and disruptive to daily life. It can lead to increased food intake and potentially affect weight management. Managing blood sugar levels through appropriate treatment, such as medication, dietary changes, and lifestyle modifications, can help alleviate persistent hunger in individuals with diabetes. If you experience persistent hunger, especially accompanied by other signs of high blood sugar, or if you are concerned about your health, it is important to consult with a healthcare professional for proper evaluation, diagnosis, and management. They can help identify the underlying cause and develop an appropriate plan to address your specific needs. 4. Unexplained weight loss. Unexplained weight loss refers to a significant decrease in body weight that occurs unintentionally, without any conscious effort to lose weight through dieting or increase physical activity. In the context of diabetes and impaired insulin function, unexplained weight loss can be a notable symptom. Insulin plays a crucial role in regulating glucose metabolism and providing energy to the body's cells. In individuals with diabetes, there are two potential scenarios that can lead to unexplained weight loss: insufficient insulin production or insulin resistance. Insufficient insulin production. In type 1 diabetes, the immune system mistakenly attacks and destroys the insulin, producing cells in the pancreas. As a result, the body cannot produce enough insulin to facilitate the entry of glucose into the cells. Without sufficient insulin, the body's cells struggle to obtain the energy they need from glucose alone. To compensate for the lack of glucose utilization, the body may start breaking down alternative energy sources such as muscle and fat. The breakdown of muscle, proteolysis, releases amino acids which can be converted into glucose through a process called gluconeogenesis. Additionally, the breakdown of fat, lipolysis, produces fatty acids which can be used as an alternative source of energy. The utilization of muscle and fat for energy leads to a loss of body mass, including muscle tissue and adipose tissue, fat, resulting in unexplained weight loss. Insulin resistance. In type 2 diabetes and some cases of prediabetes, the body's cells become resistant to the action of insulin. Despite the presence of insulin, the cells do not respond adequately, which leads to reduced glucose uptake. Similar to insufficient insulin production, insulin resistance can result in decreased glucose utilization by the cells. In response, the body may resort to breaking down muscle and fat to compensate for the perceived lack of available energy from glucose. This can contribute to unexplained weight loss. Unexplained weight loss in diabetes can be a cause for concern and should not be ignored. It is important to note that weight loss can occur in other health conditions or as a result of various factors, so a proper evaluation and diagnosis by a healthcare professional are essential. If you experience unexplained weight loss, especially in conjunction with other signs of diabetes, it is crucial to seek medical attention. A healthcare professional can assess your symptoms, perform diagnostic tests, and develop a suitable treatment plan to address the underlying cause and manage your condition effectively. 5. Fatigue and weakness. Fatigue and weakness are common symptoms experienced by individuals with diabetes or those with poorly controlled blood sugar levels. These symptoms arise due to insufficient utilization of glucose, the primary source of energy for the body's cells. Glucose is required by cells throughout the body, including muscles and organs, to carry out their functions optimally. In individuals with diabetes, there may be insufficient insulin production or insulin resistance, both of which can hinder the entry of glucose into cells. Without adequate glucose utilization, the cells are deprived of the energy they need to perform their normal activities. As a result, individuals may experience persistent feelings of fatigue, characterized by a sense of physical and mental tiredness. Additionally, the lack of energy can manifest as generalized weakness, making it challenging to engage in daily activities or tasks that require physical exertion. Even simple actions may feel more laborious than usual. The combination of fatigue and weakness can contribute to a general feeling of being unwell, affecting overall well-being and quality of life. It can impact productivity, mood, and the ability to concentrate on tasks. In some cases, the fatigue and weakness experienced by individuals with diabetes can be further exacerbated by other factors. For instance, high blood sugar levels can lead to increased urine production and subsequent dehydration, which can intensify feelings of fatigue and weakness. Managing blood sugar levels through appropriate treatments such as medication, insulin therapy, dietary adjustments, and regular physical activity can help alleviate these symptoms. By improving glucose utilization and optimizing energy supply to the body's cells, individuals can experience relief from fatigue, regain strength, and improve their overall sense of well-being. If you are experiencing persistent fatigue, weakness, or a general feeling of being unwell, it is important to consult with a healthcare professional for evaluation, diagnosis, and proper management. They can assess your symptoms, identify any underlying causes or contributing factors, and recommend appropriate interventions to help alleviate fatigue and weakness. 6. Blurred vision. Blurred vision is a common symptom experienced by individuals with diabetes, especially when their blood sugar levels are consistently elevated. The eyes rely on a delicate balance of fluid and glucose to maintain clear vision. When blood sugar levels are high, it can disrupt this balance and affect the shape of the lens, leading to blurry vision or difficulty focusing. In a healthy eye, light enters through the cornea and lens, which help focus the light onto the retina at the back of the eye. The lens adjusts its shape to ensure that the light rays converge precisely onto the retina, allowing for clear vision. However, when blood sugar levels are persistently high, it can lead to changes in the fluid balance within the eye. Elevated blood sugar levels can cause the lens to swell, resulting in changes in its shape and flexibility. This alteration in the lens shape affects its ability to properly focus incoming light, leading to blurred vision. The blurriness may manifest as difficulty seeing objects clearly at both close and far distances. Some individuals may experience fluctuations in their vision throughout the day, while others may have more persistent blurriness. It is important to note that blurred vision can have various causes, and it is not exclusive to diabetes. Other factors such as eye conditions, medications, or general health issues can also contribute to blurry vision. Therefore, it is essential to consult with an eye care professional to determine the underlying cause of the blurred vision. If you are experiencing persistent or worsening blurred vision, it is important to seek medical attention promptly. A healthcare professional or eye care specialist can evaluate your symptoms, perform a comprehensive eye examination, and recommend appropriate treatment options, which may include blood sugar management, corrective lenses, or other interventions to address the underlying cause and restore clear vision. 7. Slow healing of wounds. When blood sugar levels are consistently elevated, it can have detrimental effects on various systems in the body, including the circulatory system and the body's natural healing processes. One notable impact of high blood sugar levels is the slow healing of wounds. The healing process is a complex series of events involving various cells, tissues, and processes working together to repair damaged skin or tissues. Adequate blood flow is crucial for delivering oxygen, nutrients, and immune cells to the wounded area, as well as removing waste products and promoting the growth of new tissue. However, in individuals with diabetes or poorly controlled blood sugar levels, the elevated glucose in the bloodstream can damage blood vessels and impair circulation. This condition, known as microvascular disease, can reduce blood flow to the affected area, compromising the delivery of essential nutrients and oxygen necessary for efficient wound healing. Furthermore, high blood sugar levels can also adversely affect immune function. The immune system plays a critical role in the healing process by fighting off infection and promoting tissue repair. However, chronic hyperglycemia can weaken the immune system, making it less effective in combating infections and delaying the healing process. Additionally, diabetes can lead to neuropathy, a condition characterized by nerve damage. Neuropathy can affect the nerves responsible for sensing pain, heat, and pressure, which are important for detecting injuries and initiating appropriate wound care. Without proper sensory feedback, individuals may be unaware of wounds or injuries, further delaying their treatment and healing. The combination of impaired circulation, compromised immune function, and potential nerve damage can significantly contribute to the slow healing of wounds in individuals with diabetes. Even minor cuts, scratches, or injuries may take longer to heal, and the risk of developing infections or complications associated with delayed wound healing may increase. To promote proper wound healing, it is crucial for individuals with diabetes to manage their blood sugar levels within target ranges. This involves following a personalized treatment plan, including medication, dietary modifications, and regular physical activity as prescribed by a healthcare professional. Furthermore, practicing good wound care techniques, such as keeping the wound clean, protecting it from further damage, and seeking medical attention for any signs of infection or non-healing wounds is essential. Healthcare professionals, including wound care specialists, can provide appropriate guidance and treatment options to optimize wound healing in individuals with diabetes. If you are experiencing slow healing of wounds or have concerns about your wound healing process, it is important to consult with a healthcare professional. They can assess your specific situation, provide tailored advice, and develop a comprehensive management plan to support optimal wound healing and minimize the risk of complications. Number 8. Frequent infections. Frequent infections, such as urinary tract infections, UTIS, yeast infections, and skin infections, are common concerns for individuals with diabetes or poorly controlled blood sugar levels. Elevated blood sugar levels can have detrimental effects on the immune system, compromising its ability to effectively fight off pathogens and making individuals more susceptible to infections. The immune system is responsible for defending the body against harmful microorganisms, including bacteria, viruses, and fungi. It relies on a complex network of cells, tissues, and organs to identify and eliminate these invaders. However, chronic hyperglycemia or high blood sugar levels can weaken the immune system and impair its ability to function optimally. High blood sugar levels create an environment that promotes the growth and survival of certain microorganisms, particularly bacteria and fungi. These microorganisms thrive in an environment rich in glucose, which is their primary source of energy. The excess glucose in the bloodstream provides a favorable condition for these pathogens to proliferate and cause infections. Additionally, elevated blood sugar levels can directly impair immune cell function. Specific immune cells, such as neutrophils and macrophages, play crucial roles in recognizing and eliminating pathogens. However, in the presence of high blood sugar, these immune cells may not function as efficiently. They may exhibit reduced mobility, impaired phagocytosis, engulfing and destroying pathogens, and decreased production of certain immune molecules. The weakened immune response makes individuals with diabetes more susceptible to various types of infections. Common examples include urinary tract infections, where bacteria can colonize the urinary system, yeast infections caused by an overgrowth of Candida fungus, and skin infections, which can occur due to impaired wound healing or the colonization of bacteria on the skin surface. It is important to note that the increased risk of infections is not limited to specific types, but can extend to various other infections throughout the body. Respiratory infections, gum infections, periodontal disease, and infections in the feet, diabetic foot infections, are also common concerns for individuals with diabetes. Managing blood sugar levels within target ranges is crucial for reducing the risk of frequent infections. This involves adhering to a personalized treatment plan, which may include medication, insulin therapy, dietary modifications, and regular physical activity. By maintaining stable blood sugar levels, individuals can support the immune system's proper functioning and decrease the susceptibility to infections. Furthermore, practicing good hygiene, such as proper hand washing, maintaining cleanliness of wounds, and following recommended guidelines for personal care can help minimize the risk of infections. Seeking prompt medical attention at the first signs of infection, such as unusual discharge, skin redness, pain, or persistent fever, is essential for early diagnosis and appropriate treatment. If you experience frequent infections or have concerns about your immune health, it is important to consult with a healthcare professional. They can assess your specific situation, provide tailored advice, and develop a comprehensive management plan to strengthen your immune system, prevent infections, and address any underlying health issues effectively. 9. Tingling or numbness in the extremities. Tingling or numbness in the extremities, such as the hands and feet, is a common symptom experienced by individuals with diabetes, especially when their blood sugar levels are persistently elevated. This sensation is often referred to as peripheral neuropathy, which occurs when high blood sugar levels cause damage to the peripheral nerves that transmit signals between the central nervous system and the rest of the body. The exact mechanism behind how high blood sugar damages nerves is not fully understood. However, several factors are believed to contribute to this phenomenon. One possible explanation is that elevated blood sugar levels can cause inflammation and oxidative stress, which can directly damage the nerves. Additionally, the excess glucose in the bloodstream can lead to the formation of advanced glycation end products, AGEs. These compounds can accumulate in nerve tissues and interfere with their normal functioning, contributing to nerve damage. The peripheral nerves play a vital role in transmitting sensory information, such as touch, temperature, and pain, from the extremities to the brain. When these nerves are damaged, individuals may experience abnormal sensations such as tingling, numbness, or a burning sensation. These sensations are often described as pins and needles or feeling like the affected area is asleep. The tingling or numbness is typically symmetrical and may start in the toes or fingers, gradually progressing up the limbs. It can be intermittent or persistent, and the severity can vary among individuals. In some cases, individuals may also experience a loss of coordination or balance due to the altered sensory feedback from the affected nerves. It is important to note that peripheral neuropathy can have other causes aside from diabetes, such as vitamin deficiencies, alcohol abuse, certain medications, and underlying medical conditions. Therefore, a comprehensive evaluation by a healthcare professional is necessary to determine the underlying cause of the tingling or numbness. Managing blood sugar levels within the target range is crucial for preventing or slowing down the progression of peripheral neuropathy. This involves following a personalized treatment plan, including medication, insulin therapy, dietary adjustments, regular physical activity, and routine monitoring of blood sugar levels. Additionally, other measures can help alleviate the symptoms and promote nerve health. These may include taking certain medications to manage pain or discomfort, implementing strategies to improve blood circulation, practicing good foot care, maintaining a healthy lifestyle, and addressing any contributing factors such as smoking or alcohol consumption. If you are experiencing tingling or numbness in your extremities or have concerns about peripheral neuropathy, it is important to consult with a healthcare professional. They can assess your specific situation, conduct diagnostic tests if necessary, and develop a comprehensive management plan to address the underlying cause, manage symptoms, and promote optimal nerve health. 10. Irritability and mood. Fluctuating blood sugar levels can have significant impacts on mood and emotional well-being. When blood sugar levels are constantly changing, it can affect the brain's functioning and neurotransmitter levels, leading to irritability, mood swings, and difficulty concentrating. The brain relies on a steady supply of glucose, obtained from the breakdown of carbohydrates, as its primary source of energy. It plays a vital role in regulating mood, emotions, and cognitive function. When blood sugar levels fluctuate, it can disrupt the balance of glucose supply to the brain, affecting its normal functioning. Low blood sugar levels, also known as hypoglycemia, can cause irritability and mood swings. When blood sugar drops below normal levels, the brain may not receive enough glucose to maintain optimal functioning. This can trigger the release of stress hormones, such as cortisol and adrenaline, which can contribute to feelings of irritability and restlessness. In severe cases, hypoglycemia can even lead to confusion, disorientation, and difficulty concentrating. Conversely, high blood sugar levels, known as hyperglycemia, can also impact mood and cognitive function. Elevated blood sugar can impair the brain's ability to utilize glucose effectively, resulting in reduced energy availability for brain cells. This can lead to feelings of lethargy, difficulty concentrating, and mental fogginess. Additionally, the stress of managing diabetes or concerns about blood sugar control can also contribute to irritability and mood changes. The fluctuations in blood sugar levels can affect the balance of neurotransmitters in the brain, such as serotonin, dopamine, and norepinephrine. These neurotransmitters play crucial roles in regulating mood, emotions, and cognitive function. When blood sugar levels are unstable, it can disrupt the optimal functioning of these neurotransmitters, contributing to mood swings and difficulties in emotional regulation. It is important to note that irritability and mood changes can have various causes, and they are not exclusive to diabetes or blood sugar fluctuations. Other factors, such as stress, hormonal changes, sleep disturbances, or underlying mental health conditions, can also influence mood and emotional well-being. Therefore, it is essential to consider these factors comprehensively when evaluating mood changes. Managing blood sugar levels within the target range is crucial for stabilizing mood and minimizing mood swings associated with diabetes. This involves following a personalized treatment plan, which may include medication, insulin therapy, dietary modifications, regular physical activity, and stress management techniques. Additionally, maintaining a healthy lifestyle, including adequate sleep, regular exercise, and engaging in activities that promote relaxation and well-being, can also contribute to overall mood stability. If you are experiencing significant irritability, mood swings, or difficulties with concentration, it is important to consult with a healthcare professional. They can assess your specific situation, evaluate potential underlying causes, and develop a comprehensive management plan that addresses blood sugar control, as well as any other contributing factors to support optimal mood and emotional well-being. In conclusion, high blood sugar, or hyperglycemia, is a condition that affects millions of people worldwide and can have serious health implications. In this video, we discussed the 10 alarming signs that indicate your blood sugar might be too high. These signs include frequent urination, excessive thirst, persistent hunger, unexplained weight loss, fatigue and weakness, blurred vision, slow healing of wounds, recurrent infections, numbness or tingling in the hands or feet, and irritability or mood swings. It's important to be aware of these signs as they can indicate uncontrolled blood sugar levels and the potential risk of developing or worsening diabetes. If you experience any of these symptoms, it's essential to consult a healthcare professional for proper diagnosis and guidance. We also discussed the causes of high blood sugar, including insulin resistance and insufficient insulin production. Insulin resistance occurs when the body becomes less responsive to the effects of insulin, while insufficient insulin production happens when the pancreas doesn't produce enough or produces it ineffectively. Various factors, such as excess body weight, sedentary lifestyle, poor diet choices, genetic predisposition, and certain medical conditions can contribute to these causes. Managing blood sugar levels is crucial for overall health and well-being. It involves a combination of medication, dietary changes, regular physical activity, and lifestyle modifications, regular physical activations. By working closely with healthcare professionals and adopting a comprehensive treatment plan, individuals can better control their blood sugar levels and reduce the risk of complications associated with high blood sugar. Remember, early detection and intervention are key to effectively managing high blood sugar. If you have any concerns or suspect that your blood sugar levels might be too high, don't hesitate to reach out to a healthcare professional. Taking proactive steps towards maintaining healthy blood sugar levels can significantly improve your quality of life and reduce the risk of long-term complications. Thank you for watching, and we hope this video has provided you with valuable insights and information. Don't forget to subscribe to our channel to stay updated with our latest videos on various health topics. By subscribing, you'll be part of our community and won't miss any future content that can help you lead a healthier life. If you have any questions, suggestions, or topics you'd like us to cover in our future videos, please let us know in the comments section. Your feedback is important to us as we strive to provide you with relevant and insightful content. Thank you again for your support, and we look forward to seeing you in our next video. Stay healthy and take care.